This is a fairly unique surgery. There's not many people doing this. I wish more did it. It's been a godsend. And, I look at friends of mine that have had the knee replacements and they're missing out. Why replace the whole joint with a piece of metal that's got all kinds of negative consequences? They work, but they can't do things that I wanted to be able to do. He just gave me options and opened doors back up that I wasn't ready to close.
I hear this commonly from people in all sports. I've been told to stop the sport that they love to do. Our mission, our purpose in helping people is to help them achieve the goals that they would like to do and not be limited by the injuries that they may have suffered. Artificial joints were really not as good as we wanted them to be. They would wear out too early, or the patient's knees wouldn't feel as good as they wanted them. One of my mentors said to me that if I could ever figure out how to replace the meniscus cartilage in people's knees, I would make a big contribution to orthopedics. So I set off on that as my career goal, and much of my research over the last 30 years now has been around replacing meniscus cartilage, regrowing cartilage, or resurfacing knees, with the goal of trying to help people be better than they've been in years. When you come in for consideration of a biologic joint replacement or a BioKnee program, it usually means that you've lost your meniscus cartilage or damaged the articular cartilage of the knee or torn the ligaments. Instead of having an artificial knee replacement, an option for them is to have a biologic knee replacement, where each of these tissues are repaired or replaced or regrown. The exciting thing that we've learned in the data over the years is that when these procedures are successful, people can go back to mountain climbing, skiing, hiking, running. People really don't have to worry so much about it wearing out and them being worse off.
I liked that everybody's here in an integrated team working together, and all my problems are solved like instantly without a lot of hassle. They have the MRI machine right on the premises. So I got the MRI before the surgery, the x-rays before the surgery right here in the office, and then Dr. Stone looks at it immediately and explains to me and shows me exactly what's going on. And then post-surgery, we do the same thing. We get the scan right away, we look at it after surgery, and he can show me what's going on with him right here. So that's really great. I don't have to go somewhere else, it's all right here. And then the physical therapy team is right around the corner in the office, and they're familiar with this surgery. I think it would be a mistake for me to walk out the door and say, I could fix this on my own. I could just do some squats and lunges on my own. No, you need these guys, this team here.
Feel those muscles working on your arch.
The lower's a lot. I tell these guys, it's kind of like, to me, I travel a lot in my job, right? And you fly coach, you fly first class, and then there's first class international, which is like unbelievable, right? This is like first class international. This is like everything's done really, really well. This knee should last me the rest of my life.